Dave.
Well, the latest CDC data shows Oklahoma has the highest death rate in the country for heart disease. And so today we're talking with a health professional who's been a dietitian for over 40 years about changes to your diet that you can start today, ways that you can start eating healthy. Sherry Jackson is based out of Ascension St. Jane Phillips in Bartlesville. Good morning, Sherry.
Good morning, Dave.
We're getting right to it here in the kitchen. What are we making today?
We're doing a seafood taco. Today I've got tilapia, and I've made this with shrimp, and I've even made it with crappie. So very accessible food, right?
Crappie's very accessible in Oklahoma. I wanted to talk, Sherry, you know, Oklahoma for many years now has been the top ranked state, unfortunately, for heart disease mortality, according to the CDC. What parts of these recipes, this recipe, are you really liking for heart disease prevention?
So the fish is a real player. You know, we're looking for omega-3 fatty acids. We're trying to get away from the solid saturated fats that can be in some of the more red or heavier meats. And so the omega-3s are very helpful for the arteries. They've got some anti-inflammation, and with type 2 diabetes and the other types of pre and type 1, inflammation is really a concern, and so anti-inflammatories. And so that's going to include our black beans and, of course, some fruits and vegetables. But in addition to black beans, or any beans, peas, or lentil, seeds or nuts, anti-inflammatory, will reduce that response. And people with type 2 and really type 1, but type 2 the most, have a 2 to 4 greater chance of developing atherosclerosis. And so they're really considered a heart patient because of those studies.
And now you see a lot of patients, and you've seen a lot of patients over your 40 years. Is it generally difficult to come up with the right things to say about changing diet? Do you have ways that you can say it where it's like, hey, maybe baby steps? What is kind of your strategy to help people start taking those baby steps if maybe they've eaten one way their entire life?
Yeah, well, they got to know why.
Yeah.
And so we're going to explain why. I mean, I can tell people what to eat, but they have to be motivated for why.
Yeah.
And so understanding what's going on in their body, the physiology, the benefits of the foods, and the different lifestyle changes, you know, including moving around.
Right.
You know, and then, you know, you'll work with them, and they'll get some results in their labs, or maybe in their weight or waistline. And, you know, then that's motivating in itself.
Right, and hopefully extend that lifespan.
Yeah.
So let's talk about more what we're doing here. So what all is in this? I'm seeing just a lot of great stuff. Do we have, what's in this recipe here? So
right now we've got the crappie the tilapia that I cooked and kind of mashed as I went. It's got a couple teaspoons of chili powder.
Oh, yeah.
And I did add a little salt and pepper. And I want to talk about salt. Yes, we do need to reduce salt in our diet, but sodium is really the culprit. And so sodium absorbs fluids, can increase blood pressure and cause swelling and so on. But 77% of the sodium in America is already in the food. And so using fresher foods are going to bring that sodium level down in your diet. And so just a little bit of seasoning, you know, is not as major as maybe getting something out of a box or can all the time. So,
looking at those labels, important, that sodium content, the percentage of your daily value of sodium, and then you can tell how much sodium is already in it. That's really good. Okay, so we've got some black beans in here.
Yes.
Beans, good source of protein. We know that.
Yes, it's a plant-based protein. And so there's other ways to get protein besides meat. And so we're always trying to combine that, or even use a plant-based protein as a main entree. And so I'm adding some salsa and onions to my black beans, and my family likes it that way, and so do I.
Yeah, I would like
a little,
too.
Yeah, a little spice on the matter. And so this is a great option for us there, and I'm gonna turn it down a little.
Right, and so you've got a sauce too, because if we're doing fish tacos, if we're doing shrimp tacos, fish tacos, we gotta have a good sauce, a nice little something on that. I love the way this sauce looks here.
Yeah, so we're gonna add pico de gallo to it, and I like the spicy kind, but you know, that's up to you. But then again, it's fresh tomatoes, jalapenos, onions, maybe a little cilantro, and so, I mean, how fresh can you get right there?
Right. And then coleslaw.
Yeah, so the topping is this coleslaw. So I just bought a package already shredded. I'm going to add some light mayonnaise. So now I'm trying to reduce fats again. And I've added, you can do the chipotle kind, or I just do it on my own and just add that chili powder to it.
Yep, and making your own healthy sauces. My wife does this, your own healthy dressings. It's really not as hard as you would think. You just got to try it. Because people want to buy the stuff out of the package, which we all did,
It's convenient, but not as healthy.
You can do it. You can do it yourself. I know my wife does it all the time.
Then I added the cilantro. And so this is, and so instead of just iceberg lettuce, we've got some things here that are what we call more fiber. And so fiber, of course, reduces the absorption of cholesterol and those kinds of fats that would harden the arteries. So once again, that's very heart healthy. We've got a fresh product. So now we've got more nutrients called phytochemicals. These are vitamins and minerals, I always say, that in God's food that we don't even have a name for yet. So we got to try to get those in there. And so this spicy kind of coleslaw is a great topping for it.
Well, Sherry, time flies. This has come together so fast. We thank you so much for the seafood tacos recipe. Just give us a little bit. It'll be up on newson6.com. Sherry Jackson, Ascension St. John, Jane Phillips in Bartlesville. You can contact them as well if you need help with your diabetes. They have a great program.
Yes.
So get in touch with them. Sherry, thank you so much.
Thank you.